face. The miraculous new anti-aging breakthrough that's not for your face.
This is a procedure that has no downtime.
Can you imagine what that's going to do to my sex life?
Find out if it really works. That's today.
But first, which cosmetic surgery went up 109% in the past few years?
Guess.
Breast augmentation? Tummy tucks?
Oh, you're getting closer.
Very close. Labioplasty.
There you go.
You had it.
That's not what he meant.
I didn't.
I mean, he didn't.
You had the right answer.
Right,
You got labioplasty. That's between.
He didn't mean you had it. But more and more women are having this cosmetic surgery for their private parts, and now there's a way for women to look even younger and feel even better in this area down there without undergoing surgery.
So no knife involved, and in fact, as we speak, Dr. Berman is in our procedure room with gynecologist and reconstructive surgeon Dr. Alansad, who has a patient who's about to have this procedure done, and explain to us exactly what we're talking about here in terms of this procedure.
ThermiVa is a beautiful little wand that's smaller than the size of my finger, that's very effective and very gentle in producing heat right on the tip and place it deep inside the feminine structures.
So this is for internal, external use for tightening?
Yes.
The outside and inside.
It's a anti-aging procedure for tightening the external labial structures and for tightening the internal vaginal structures. And at the same time, guess what it does?
Give you a more youthful, feminine...
A youthful, feminine vulvovaginal area.
Like when we were in our 20s, Grace, or
Yes.
30s, hopefully?
It stops leaking. It improves texture and tone and moisture and improves the sensitivity in tissues that we treat.
So sensitivity and sensation is important. You know, out there, you guys, it's fun and it's funny to talk about, and I'm all about that, but this really is an important subject that a lot of women struggle with. A, how it looks down there, and B, how it feels down there as we age. Now, Gracie and I here, thank you so much for coming, are sharing our stories here. How old are you, Grace?
58.
Okay, so she looks 38, right? And she wants to feel 38. So tell us why you're here and why you want this procedure.
Well, you know, when you get older, you have the problem with incontinence, which I do have. However, I was talking yesterday with Dr. Alansad, and he told me about a client who was, because of the increased sensitivity, was able to achieve 6 orgasms in a row. Can you imagine what that's going to do to my sex life?
All right. I want to keep expectations. We got to manage expectations. In theory, improving sexual function, sexual sensation, improving urinary control, and also how things look. Are you satisfied with the way it looks down there, or do you feel like you want things lifted and tighter?
I'd like it, shall we say, freshened up.
All right.
Well, and is it fair to say really quickly, Dr. Alansad, that a procedure like this whole idea of tightening up, improving, as opposed to a bigger procedure, formal surgery, going under the knife, this seems like it's something that's probably a little more accessible to more women. Is that fair to say?
Yes, it's very fair to say that you can go to the gym the same night, you can have sexual relations with your partner the same day, you'll feel the tightness effect the same day. But over 3 months, the effects are so dramatic. Starting at 2 weeks, the tissues get softer, firmer, tighter, and the sensitivity that increases in both the G-spot areas and the clitoral areas and just the genital areas are quite amazing.
Are you going to be targeting the G-spot and the O-spot and all those areas? And I just want to say how it works. It is radio frequency heat that actually changes the collagen in the vagina. Is that how it's changing the soft tissue, the collagen and structure of the support of the vagina?
Brand new collagen that's softer with an improved blood flow.
Sure.
It improves the localized blood flow so that there's a lot more moisture produced and the patients are a lot more comfortable. And because of the blood flow, the nerve sensitivity is dramatically improved.
Okay, so collagen, blood flow, nerves.
And obviously, this is a quick procedure since we're going to be doing it during the show. So we are going to let them get started on the procedure in private. And we're going to reveal those results a little later in the show.
Coming up next, the doctors demystify vaginal rejuvenation.
There are doctors who believe that it's a slippery slope and we shouldn't be sending the message that there's an ideal feminine aesthetic.
That's next.
These days, it's not just about looking young up here. There's a new procedure that can make you look 20 years younger down there. Dr. Berman's back in our procedure room with all the details that we discussed a little earlier. So, Dr. Berman, tell us how things are going.
How excited she looks.
As you can tell, they're going so well with her that now I am ready to be the next subject here. I mean, I am so overwhelmed. I've been here through the whole thing. She's been such a trooper. Anyways, tell me, what do you think? She has her mirror. We looked. She saw. What do you think?
Amazing. I could tell the difference visually when I looked at the photo and checked it out with the mirror.
Which we
amazing.
I'm sold. So I'm next. I think Jen Ashton is after me. Me, then Jen Ashton, and then I mean, I'm so proud. I'm so excited. We can't wait to hear. I can't wait to get it. Thank you so much.
Now, how much is this procedure? If I'm going to be the third person, how much does it cost, and how many treatments are normally required?
Well, the procedure costs anywhere from $3,500 to $6,500 for a series of 3 treatments. And I recommend touch-ups once or twice a year, so you never have to have a mesh, you never have to have any kind of foreign bodies. This can help with your incontinence, your dryness,
and you know,
tightness.
I just want to make a serious point here. You know, vaginal rejuvenation surgery or cosmetic labiaplasty is controversial, and there are doctors who believe that it's a slippery slope and we shouldn't be sending the message that there's an ideal feminine aesthetic. I take the opposing view that this is 2015. These are modern times. If you don't like your nose and you want to have a nose job, if you don't like your labia and you want to get that fixed, this is all on your body, and you should have the prerogative to do that. So
absolutely.
Well, Grace, Dr. Allen, thanks for joining us. And Dr. Berman, so shall we bid you adieu? Because you're doing this, you're not hosting the rest of the show with us.
How could I not get it? $3,500 or whatever. That's priceless.
So we're gonna have on our website, after Dr. Berman gets this done, we're gonna interview her and share whether or not she's happy with her results at thedoctorstv.com. We'll be right back.